On the morning of Sunday, August 6, 2023, paramedic engine 712, paramedic engine 716, and truck 716 were dispatched to a high-rise apartment building for the report of an odor of smoke on the 20th floor. Upon arrival to the scene, the crews began to investigate the source of the odor and discovered smoke conditions in the hallway on the 19th floor. Upon further investigation, revealed black smoke stains around the door frame and smoke coming from the door of an apartment. The crews requested additional resources to the scene and forced entry into the apartment. Upon entering the apartment, the crews were met by heavy smoke and fire in the living room. An unconscious patient was located in the alcove directly behind the apartment door. Firefighter Palumbo, firefighter paramedic Schermerhorn removed the patient from the apartment and dragged him to the elevator and initiated patient care as they rode the elevator to the lobby. Meanwhile, the crew from paramedic engine 716 worked to extinguish the fire as truck 716 crew performed a search of the apartment. A second victim was located in the back bedroom. Lieutenant Artingstall and firefighter Coxon removed the patient from the apartment as Master Firefighter Barnes assisted with moving the patient to the lobby for treatment. In the lobby, firefighter paramedic Schermerhorn, Berube, and the crew from ambulance 712 performed an assessment of the first patient removed from the fire apartment. The patient was unresponsive and apneic with a rapid pulse. Soot was noted around his mouth and nose. Crews worked together to ventilate the patient via bag valve mask and high-flow oxygen. The patient began to breathe on his own and regain consciousness. The patient was able to follow commands but was unable to communicate. Further assessment revealed second and third degree burns to 40% of the patient's body, including his face, hands, feet, chest, and thighs. Crews were able to establish vascular access and prepare to administer cyanokit, as well as administer fentanyl for pain management. The patient was packaged and transported to MedStar Burn Center. En route to the hospital, high-flow oxygen was administered via non-rebreather, an IO was placed for a second vascular access site, medical consult was performed via EMRC, and the patient's airway and condition were closely monitored for any changes. The second patient was assigned to the crew of Medic 712. The patient was found to have agonal respirations with a strong rapid carotid pulse present. The patient's airway was managed with a BLS airway and ventilations were assisted via bag valve mask. Firefighter paramedic Master Horchar was assisted by Master Firefighter paramedic Miller from paramedic engine 724. The patient was placed on the cardiac monitor with sinus tachycardia noted and vascular access was obtained via an IO. Due to the patient's continued agonal respirations, an attempt was made to intubate the patient to protect his airway. The patient was suctioned, and when the crew attempted to insert an endotracheal tube, the patient presented with a gag reflex, so the intubation attempt was terminated. It was noted during the attempt that the patient did appear to have some swelling and burns in the airway. Further assessment revealed second and third degree burns to the patient's face, scalp, neck, and extremities. The decision was made to package the patient and move him to the EMS unit and prepare for transport to MedStar Burn Center. En route to MedStar, crews worked together to continue assisting the patient with ventilations, performing medical consultation, and prepared the administration of the cyanokit. During transport, the patient's mental status improved and he attempted to sit up. The BLS airway was removed and a nasal cannula was placed on the patient. During the remainder of the transport, the patient's vitals, airway condition, and other injuries were closely monitored. Thanks to the teamwork, skills, and knowledge of the crews on the scene from both patients were given a chance of survival and more time with their families. Both patients continue to recover from their injuries at a rehabilitation center. Great job.